Hi, my name is Kim Lawrence Soldi Mulato, section 24 from Group 12, and today I'm going to report about pneumonia. Here are the content. Definition of pneumonia. Pneumonia is an infection that inflames your lungs' air sacs or alveoli. The air sacs may fill up with fluids or pus, causing symptoms such as a cough, fever, chills, and trouble breathing. Infectious agent. Pneumonia is caused by a number of infectious agents, including viruses, bacteria, and fungi. The most common are Streptococcus pneumonia, the most common cause of bacterial pneumonia in children, Haemophilus influenzae type B, or Hib, the second most common cause of bacterial pneumonia. Respiratory syncytial virus is the most common viral cause of pneumonia. In infants infected with HIV, pneumocystis jirovecii is one of the most common causes of pneumonia, responsible for at least 1/4 of all pneumonia deaths in HIV-infected infants. Here are the signs and symptoms. Cough, which may produce greenish, yellow, or even bloody mucus. Fever, sweating and shaking chills. Shortness of breath, rapid, shallow breathing, sharp or stabbing, chest pain that gets worse when you breathe deeply or cough, loss of appetite, low energy and fatigue, nausea and vomiting, especially in small children, confusion, especially in older people. Here are the mode of transmission. Pneumonia can be spread in a number of ways. The viruses and bacteria that are commonly found in child's nose or throat can infect the lungs if they are inhaled. They may also spread via airborne droplets from a cough or sneeze. In addition, pneumonia may spread through blood, especially during and shortly after birth. More research needs to be done on different pathogens causing pneumonia and the ways they are transmitted, as this is of critical importance of treatment and prevention. Here are the diagnoses. Uh, Blood tests. Blood tests are used to confirm an infection and to try to identify the type of organism causing the infection. However, precise identification isn't always possible. Chest X-ray. This helps your doctor diagnose pneumonia and determine the extent and location of the infection. However, it can tell your doctor what kind of germ is causing the pneumonia. Pulse oximetry. This measures the oxygen level in your blood. Pneumonia can prevent your lungs from moving enough oxygen into your bloodstream. Sputum test. A sample of a fluid from your lungs or sputum is taken after a deep cough and analyzed to point the cause of the infection. Here are the other tests if you're older than 65 years old. CT scan. If your pneumonia isn't clearing as quickly as expected, your doctor may recommend a chest CT scan to obtain a more detailed and pleural fluid culture. A fluid sample is taken by putting a needle between your ribs from the pleural area and analyzed to help determine the type of infection. Here are the treatment. Pneumonia should be treated with antibiotics. The antibiotic of choice for the first-line treatment is amoxicillin, dispersible tablets. Most cases of pneumonia require oral antibiotics, which are often prescribed at a health center. These cases can also be diagnosed and treated with inexpensive oral antibiotics at the community level by trained community health workers. Hospitalization is recommended only for severe cases of pneumonia. Here are the medical management. The management of pneumonia centers is a step-by-step process that zeroes on the treatment of the infection through identification of the causative agent. Here are the medical management. Blood culture. Blood culture is performed for identification of the causal pathogen and prompt administration of antibiotics in patients in whom CAP is strongly suspected. Administration of macrolides. Macrolides are recommended for people with drug-resistant S. pneumonia. Administration of antipyretics. Antipyretics are used to treat fever and headache. Administration of antitussive. Antitussives are used for treatment of the associated cough. Bed rest. Complete rest is prescribed until signs of infection are diminished. Oxygen administration. Oxygen can be given if hypoxemia develops. Pulse oximetry. Pulse oximetry is used to determine the need for oxygen and to evaluate the effectiveness of the therapy. Aggressive respiratory measures. Other measures include administration of high concentration of oxygen, endotracheal intubation, and mechanical ventilation. And here are the nursing management. Nurses are expected to perform both dependent and independent functions of infections. So nurses are expected to perform both dependent and independent functions for the patient to aid him or her towards the restoration of their well-being. And here are the references of my research. I hope you enjoy and learn something in pneumonia. And that's all. Thank you for watching and goodbye.